Joining me now to appraise Nigeria's public health system amid the COVID-19 pandemic is a public health physician and lecturer at the College of Medicine, University of Lagos, Dr. Doyin Ogunyemi. Thank you for joining us at this time. The expectation earlier was that Africa's health infrastructure was going to crumble under the weight of the pandemic. How do you think that our health system, particularly in Nigeria, has fared since the first case was recorded February last year?
Okay, thank you for having me. We have to admit that the proportion of cases in Nigeria is not similar to Western world, and therefore Nigeria has not crumbled under the weight of COVID. However, we have to not rest just yet, because this second wave has affected more people and is probably being transmitted faster. And so much more now, we have people needing more care than before in terms of symptoms, in terms of needing oxygen and other infrastructures that has now shown that there is a gap in the health system. So ICU gaps, the experts who are going to man ICUs, oxygen, infrastructure, bed spaces, to the extent that it is those that are probably able to pay a lot of money out of pocket that are able to access private facilities where beds may be available if you have the money. And therefore, this increases the inequity gap that already exists between the poor and the rich when it comes to health system in Nigeria. We're not doing badly, but there's a whole lot more that we can do. And we are
indeed, Dr. Ogunyemi. We had the Minister of State for Health saying that the hospitals are now fast filling up. What's the implication of having the cases increase in the coming days?
Yeah, if the cases increase, what will happen is that you will then have to choose who you would admit and who you would not admit. You have to make such choices. The tendency is for some people that need to be admitted, they may have to go back home for care. And therefore, cases that ordinarily should not die may end up resulting in death. Apart from that, when you have more COVID spaces, the tendency is to convert some other places that are for routine health services into COVID care centers. And when you do that, it also then affects people for normal routine antenatal care and all other kinds of routine care that we expect to occur. And you would have people also not coming to the health facility because they are afraid of getting an infection in the hospital. So all of this thing is going to weigh down negatively on the health outcomes, both on COVID cases and non-COVID cases, directly and indirectly. That is what will happen.
Is there any sense to which alternative medicine should be considered? I mean, we've seen a lot of progress made with the trado herbalists, or so we call them in this part of the country.
I mean, we have a lot of natural products that have their very useful, they're useful in general. But what we see is a lack of research in saying that if, for instance, this natural substance is good, how much of it should we take? In what quantity? Is it too acidic? Because you're going to have people ingesting all sorts of things that may then give ulcers or other kinds of illnesses, by the way. Not because the thing in itself is bad, but because of too much use. And so we need to subject our alternative medicine to more research so that we can quantify it and say this is safe to use. But I agree that we need to look inwards and we need to see what works for us as a country.
Indeed, we see how all of that play out. Dr. Doyin Ogunyemi is a public health physician and lecturer at the College of Medicine, University of Lagos. Thank you for sharing your thoughts with us tonight.
Thank you for having me.